Joining us live right now, Dr. Alex Jahangir of the Metro Public Health Coronavirus Task Force. Thank you so much, Doctor, for being back with us today. This is, we've got some things we need to talk about, especially from over the weekend. Let's talk the numbers first. They're troubling. And earlier today, your task force announced that we are going to be staying in phase 2. So what do you think is causing this large case increase?
Well, I think that's part of the reason that we are actually not advancing is to figure that out. As you just mentioned, we had about 300 new cases reported to us, 200 of which happened a week or so ago. And so since we were just made aware of those numbers, our very extensive contact tracing team is right now actually looking through those cases and calling these individuals and trying to get a sense, is there anything that out of the ordinary that might have happened? Was it related to a work or an event or any of the protests or marches this past week or two? And that's what contact tracing does. And if we determine that there isn't one specific thing or there's nothing that needs to be done to mitigate any more risk, then that gives us confidence. But that's kind of part of the reason we pumped the brakes, so that we had time to exactly do what you just asked, explore what is causing this increased case.
So what would you like to see before we go to phase 3? And how long do you think it's really going to take for us to get there?
Well, what I would tell you is, let me tell you what I do like seeing currently. Our hospital capacity right now is really good. We're in about 30% range of both ICU beds available and regular beds available. Our mortality rate has been stable. We're fortunate that we have not had as much death because of this as in other cities. And in fact, we've had the same number of people. We have not had anyone reported that has died over the past 4 or 5 days. But I think what we are trying to see is make sure that our numbers of cases does at least stay at a plateau, or maybe or head downward or slightly going upwards. But we need to know where we are before we just open up the gates more and let potentially more spread occur.
And what about the pictures from the bars that we saw? I mean, that is really alarming. What does it take for a business to be cited for violating these reopening laws?
Well, I want to first begin by saying, most businesses have been wonderful partners to Nashville and have done what is needed of them and us, all of us, to keep the numbers down. But what it takes is, I think, as Jeremy Finley said in his piece, is there's certain things. So we need to have social distancing. Currently under phase 2, bars are closed, 50% capacity, 75% capacity at restaurants. And employees need to wear face masks. And I think the first several weeks of this, we really just tried to continue to educate and so forth. But now we're getting to a point is most people and most businesses know what's right. And when you're not doing what is right, then I think it is, it's important for us to cite those businesses so that the ones that are doing the right thing keep getting rewarded for that.
So many businesses, they're working so hard, like you said, to do the right thing, and we certainly appreciate all those efforts. Dr. Jahangir, thank you so much. We'll see you again in about a half an hour. Appreciate it.
Yeah, thank you so much.